on one flight there were 3 cases.
食物及衛生局咧引用
So the Food and
預
Health
防及
Bureau
控制疾病條例咧係
would invoke the Prevention and Control of Disease Regulation. And then Japan Airlines would be asked to suspend flights from Tokyo to Hong Kong for 14 days from the 11th to the 17th of April. And then Turkish Airlines will also have to suspend flights from the 10th to the 16th of April. As for specimens analyzed, there were 634 specimens analyzed. There were no samples that tested positive to L452R, and 624 cases tested negative to L552R, meaning the Omicron cases. And outbreak yesterday, there were 23 homes with new cases involving 29 residents. And there were 10 other homes that had outbreaks or cases previously. They have reported new cases yesterday involving 13 residents. For the latest fatality number, for the 5th wave of the epidemic, there are so far 8,557 death cases, an increase of 5 cases compared to yesterday. And the fatality rate is 0.727%. As for cases aged 80 or above, the fatality rate is as high as 10%. And then in the past week, we see there's downward trend in the number of new death cases every day. Now, on the 20th of April, there was about a peak with 300 cases a day. Now it's dropped to under 100 cases. And for death cases, age is 11 months and 112 years old. The median age is 86, and 3.8% involved adults aged 18 to 54. 96% of cases involve elderly aged 60 or above. And for those aged 80 or above, they accounted for 70% of all the death cases. And on the vaccination records, 73.5% of all death cases have not been were never vaccinated, and then for 14.7% had one jab, only 7.6% had 2 jabs or more. As for the fatality rate, if we look at the whole population, among those not vaccinated, the fatality rate is 2.92%. Compared to those who've had 1 jab, 2 jabs, or 3 jabs, the fatality rate is 0.93%, 0.15%, and 0.03% respectively. So in other words, for those who've had 3 jabs or more, compared to those who've not had any vaccination, the difference is 97 times. As for the elderly aged 80 or above, the death rate is 10.1% for those unvaccinated. For those who've had 1, 2, or 3 doses, the death rate dropped to respectively 6.36%, 3.858%, and 1%. As for elderly who had 3 doses compared to the unvaccinated, the difference is 10 times in terms of fatality rate. And then the Center for Health Protection has also done some analysis about cases involving children. We want to look at serious cases involving children and whether they've had vaccination. For those aged 18 or below, as at the 3rd of April, the CHP has analyzed 103,845 cases. For 48 of the cases, patients were hospitalized, and the hospital authority classified their cases as serious or critical at one point. For those aged between 3 and 17, there were 30 cases. And among the child cases with serious or critical condition, for children not vaccinated, there's 8 serious cases per 10,000 cases. For those who've had 1 dose, there are just 2 serious cases per 10,000 cases. For those who've had 2 doses or more, then there's just 1 serious case per 10,000. For those, for those who are not vaccinated, for those who've had 2 doses or more, the difference is 8 times. So I would like to appeal to parents, because school is about to start. If your children have not yet been vaccinated, please take them to the vaccination center for vaccination as soon as possible. Thank you.
We'll now hear from Dr. Lau about the situation on the HA side. 9,149 patients are receiving treatment at public hospitals: North End Hospital Infection Control Center, Hospital Authority Infectious Disease Center, and the COVID treatment facility at the Asia World Expo. Last night, we reported 5 patients in critical condition and 11 patients in serious condition. 62 patients in critical conditions are staying at the intensive care unit. As at midnight last night, over the previous 24 hours, 53 patients who tested COVID positive passed away, 23 males, 30 females, age range between 62 and 104. Among the people who passed away yesterday, 25 people came from care homes, 31 had no vaccination record, 9 had 1 jab. 40 of those who passed away yesterday have not completed the 2-dose vaccination course, roughly 75%. 12 had 2 jabs, 1 had 3 jabs. Among those 65 or above, there were 50 of such patients. One of them, a relatively younger, 62-year-old male, he had a tumor which spread to his stomach and brain. This was a resident of a care home for the elderly. On March 13th, he tested RAT positive. On 15th of March, due to shortness of breath, cough, and phlegm, and a drop in his blood oxygen level, he was taken to the A&E department. A deep throat saliva was taken, which came back positive. CT value was 17. The patient was admitted to hospital. During his stay, antivirals were prescribed, including remdesivir. His condition improved. Shortness of breath and cough receded. On March 30th, he was transferred to Hong Kong Buddhist Hospital for palliative care because he had an end-stage tumor. Then his condition deteriorated. Yesterday, he passed away. I want to report 2 cases previously unannounced. On March 9th and 19th of March, on April 8th, 10 patients also died. There are 12 such cases, 7 males, 5 females, aged 31 to 93. The 1 patient, a 31-year-old male. In August last year, he had his 2nd dose of Comirnaty vaccine. In mid-October last year, he had fever, chest discomfort, visited a private doctor. An ECG revealed that something irregular, so he was transferred to a public hospital. On October 17th, he went to a public hospital and complained about fever and chest pain from October 16th onward. At hospital, ECG suggested irregularities. He was given a PCR test. The result came back negative. The diagnosis was a heart condition. Drugs were prescribed. His condition improved. He was discharged on October 20th last year. In our records, he did not come back for another visit. After discharge, he went to a private doctor, but we don't have relevant records. On March 9th, his family members found that he fainted at home. He also had convulsions for around 30 seconds. His family called an ambulance. The ambulance officers found no heartbeat or breathing. Upon arrival, they tried to perform CPR on him. By the time he reached the hospital, there was no heartbeat, no breathing was detected. He was intubated. Sadly, the resuscitation was in vain. The patient passed away at the A&E department. He was given an RAT at the A&E department, which also came back negative. On April 6th, the patient was taken to a public mortuary for a forensic pathologist, took a specimen for testing, and found COVID, but the CT value was above 30. We weren't aware of him being a COVID patient at first because of the negative test results, but on April 6th, a lung specimen was taken and then we found COVID. That's why we're announcing this case today. Over the past day, we have 878 patients discharged upon recovery. 6 patients were found COVID positive upon hospital admission or testing in hospitals. 8 patients in the same ward were listed as close contact. 21,636 staff members of the HA tested positive, and 20,383 have returned to work. That's all from me. The floor is now open to questions. Please tell us your media organization before putting your questions. Let's start with the lady over there. I'm from TVB. Among the imported cases, how many tested positive through RAT and through PCR respectively? Regarding the RAT testing exercise, there has been a 30% increase in reported positive cases, but 17% were asymptomatic cases. Why are we getting so many asymptomatic cases? Do they still spread the virus? Would that make it harder for us to contain the virus in the community? For the 3-day RAT testing exercise, we're getting to the end. How helpful do you find this exercise? Why won't we know the full results until Tuesday? Thank you for your questions. First, the imported cases. Among the cases confirmed yesterday, 18 are imported cases. 13 were identified during the test and hold arrangement at the airport. All of them are PCR positive cases. 5 cases were found during the quarantine period at hotels. These are RAT positive cases. The second question, the mass RAT test. We have observed a number of things. The exercise is still going on, today being the last day. We appeal to those who have not done an RAT test. Do an RAT test today. If you test positive, report the result online. Over the past 2 days, we only have a preliminary figure. As we explained, those who test positive can report the positive result on the same day or the following day. After they get the SMS, they have a 24-hour window to upload a picture of the HPID card and the test cassette. some may have delayed reporting the result, and we haven't recorded those cases yet. If you test positive, report the test result right away. But some figures may not be reflected until a day or two later due to the delay in reporting. The preliminary figure is roughly 2,200. For tests done on April 8th and 9th, we expect the figure to go up. Dr. Chuang yesterday mentioned this, and the chief executive also explained this morning. Before April 8th, those who declared their RT positive results, among the 420,000 or so cases, roughly 65% were symptomatic patients. The remaining 35% were asymptomatic cases. Previously, people had symptoms, so they did an RT, and the result came back positive. So the 65% positive rate is expected. But starting from April 8th and also for April 9th, among the confirmed 2,202 cases, it's the other way around. 68.7% are asymptomatic cases. That gives us an idea that some people who are asymptomatic have heeded the appeal, so they did an RT test. Through the RT, they found that they are COVID positive, so they declared the result. The figures show that there's an increase in RT cases, asymptomatic carriers. They wouldn't otherwise have done an RT test. But through this exercise, they got tested and declared their positive result. Another point we observed over the past week or so, the ratio of RT and PCR tests are roughly 1-to-1. From April 1st to 7th, we had 12,855 cases. That's RT tests. And for PCR, 12,965 cases. So they're roughly comparable. The fluctuation, or rather, the ratio was 0.87 to 1.22. But yesterday, this ratio, RT to PCR ratio, there was an increase in the RT cases. The ratio rose to 1.8 RT test to 1 PCR test. The analysis shows that there have been additional RT cases. So now there are roughly 2,202 RT cases. We expect the number to increase after people declare their RT positive results, and then we will have a more accurate number.
Next, the lady in front, please. I'm from Cable. There's mention of this 31-year-old male deceased. Did he have any chronic condition? Well, if I may correct a figure, in the past day, 878 patients recovered and were discharged. Coming back to this male patient, from record, he was admitted to the public hospital in October. But before October, we did not see any records of underlying condition. In October, he had chest pain, he had a fever. First, he went to a private doctor, and then because the private doctor saw irregularities in his ECT, so that's why he was sent to public hospital. And then he was given medication, to treat the inflammation, and he became better, much better. And then some tests were done on him, including ultrasonic test, and it was suspected that he had pericarditis. I'm from Cable. Now, there's experience overseas that when a school resumed face-to-face classes, school children became infected and then they passed it to their family members. Now, in Hong Kong, schools are to resume soon. Will we face the same risk? This morning, the chief executive said they're considering whether to ask the students to do the RT before going to school. So have they talked to you about the CHP, that is, about the details, and then would they ask parents to buy the RAT on their own or what? And would you still describe the epidemic as serious now? If we announce the relaxation of social distancing measures now, would people then let down their guard and there is risk of resurgence? And so what would be the best scenario? How many cases should we have before we relax these measures and so on? Thank you for your question about class resumption. This morning, the Chief Executive gave some initial information. Of course, going to school is very important for the academic and whole person development for school children, because the epidemic is stabilizing. So the government has already announced that schools will resume from end April. I think I'll leave it to the Education Bureau to announce the details. Well, with the class resumption, what's important is risk management. We have to make sure that school place is safe and there won't be major transmission at school. In the past week, the CHP and the Education Bureau have been in discussion. We want to update guidelines for class resumption so that there will be a safe environment that would prevent outbreaks or major infection cases. Now, for teachers, school staff, and students, they all have to take certain measures. Now, for children with symptoms, they must not go to school and they must take tests, especially if they show symptoms, they must do RAT, and if they test positive, they should not go to school. So we want to encourage students, parents, and school staff to get vaccinated as soon as possible. That would help to enhance protection. For the ventilation system of schools, CHP will formulate a guidelines to make sure that there won't be airborne transmission due to poor ventilation. And of course, if there are cases in schools, we'll do follow-up investigation. We'll also do risk assessment to see whether there is need for additional protection measures to prevent the spread of the virus in schools. Your second question about relaxing social distancing measures. The Chief Executive already talked about that this morning. That is, as the epidemic stabilizes and there is a downward trend, then in the next 3 months, the government is going to relax social distancing measures in 3 phases. Now, so we hope that as we see the epidemic stabilizes, then we'll be able to relax those measures. I think I will leave it to the relevant department of the government to make a detailed announcement next week. On universal testing, again, the Chief Executive answered questions on that this morning. We have to wait till the 3-day mass voluntary RAT testing exercise to be completed. After we've collected new data, we'll do an analysis and assess the situation in Hong Kong. We have to consider the evolution of the epidemic, and we have to see if we could enhance our PCR testing capacity. We also have to consider the impact on the public. So today, there is not a definite answer yet on compulsory universal testing. Your last question, sorry, I forgot about your last question. Just now we gave some figures because we haven't yet completed the mass voluntary RAT testing exercise. We've only got figures for the first 2 days, and then we know that there are members of the public who may have done the test yesterday or the day before yesterday, but they have not yet completed the whole declaration process. So we may have to wait till Tuesday next week when the declaration is completed, and then members of the public would have received the SMS after 24 hours, and then they have to upload their photo and ID card, and then we'll have the actual figures. For the first 2 days, at least so far, we have found 2,202 RAT positive cases. On the ratio between symptomatic and asymptomatic cases, and also on the ratio between RAT and PCR positive cases. Well, from these figures, we can tell that many more people are doing the RAT in the past 2 days. And the RAT has helped to find positive cases, especially for those without symptoms. So we could see, therefore, initially, from this exercise, we're able to identify a large number of asymptomatic cases. If you look at figures yesterday, we see a reverse show of the trend. There's an upward trend. There's an increase, actually, 800 plus PCR tests. If there's an overall increase in number, then we should have as 800 to 900 RAT tests too, according to the usual ratio. But yesterday, instead, there were about 1,600 RAT tests, so much higher than the day before.
Next question. I'm from News. For those aged 3 to 11, the vaccination rate is hovering around 60%. Experts are concerned that given class resumption, there may be a rebound in infections. Are there further measures from the government to boost the vaccination rate among children? Infection numbers have been dropping recently, but experts have predicted a sixth wave between June and September. And the first generation vaccines may not be very effective against Omicron. There are calls for the fourth dose of vaccine. Given a possible sixth wave of outbreak, what strategies do you have in response? And on the fourth dose of vaccine, what measures would there be in this regard? Thank you for your questions. First, the vaccination rate among children. Indeed, for those aged 3 to 11, the vaccination rate for the first dose is roughly 60%. This is not great because it's on the low side. The government has been working hard to boost vaccination rate among that group. For those aged 3 and above, they can take the Sinovac vaccine, and for those 5 or above, they can take the Comirnaty. With class resumption around the corner, I appeal to parents that if their children are unvaccinated, parents should arrange for the children to get vaccinated before class resumption. Vaccination is highly effective in preventing serious cases among children. Even getting one dose will help compared with no vaccination at all. If 2 jabs will help slash the risk of critical infections, a difference of 8 times. So that I appeal to parents that before the classes resume, get your children vaccinated to protect their children from infection after classes resume and prevent serious cases, even if they do get infected. The Education Bureau is in touch with schools over possible measures schools can take to prevent infection after classes resume. In terms of rapid antigen tests and other measures schools can take. As for the possible sixth wave, it's impossible to predict. COVID has eased off, but there may be new variants emerging elsewhere, new mutations elsewhere, and after a while, people's immunity may drop. That adds to risks of infection. We will keep monitoring the COVID situation for any signs of rebound. Vaccination is the most effective way to minimize infection risks. The Scientific Committee and the Chief Executive's Expert Advisory Panel have been looking at the latest scientific data in terms of the fourth dose of COVID vaccine. Those aged 60 or above should get the fourth dose of vaccine to strengthen the protection. We see a low vaccination rate among the elderly, and for many of those who passed away, over 96% of them were members of the elderly, so seniors are at particularly high risk. Vaccines are highly effective in lowering the risks of death. The immunocompromised should also get a fourth jab. The scientific committee will continue to look at the latest developments about vaccines and the latest scientific data. When necessary, they will have a discussion over whether there's a need for the fourth dose or other vaccines. Next question. The journalist, the gentleman at the back. I'm from Now TV. About the mass RT test exercise. Are the declared cases within the number that you expected? Does that truly reflect the infection level in the community? Is it going to be an indicator for a future universal testing exercise? Another question about class resumption. The chief executive said they will look into possibly getting people to test it frequently after class resumption. How frequent does it have to be? Is it a daily test or what? Another question, the indicator as to when classes have to be suspended again. Under what circumstances will you have a full suspension or partial suspension? Thank you for your questions. The mass RT testing exercise, as we mentioned, for April 8th and 9th, those who took tests on those 2 days, we picked up 2,202 RAT positive cases. These are cases successfully declared, and we expect the number to go up. For now, it's hard to tell how many exactly we will find in the end. Most cases were found on day 1, and on the second day, the cases dropped. People have been following our advice. That is by taking RT tests from April 8th. Most cases were picked up on April 8th. And for those who tested positive on day 1, they wouldn't do it again on day 2, so there was a drop in day 2. We have to wait till the whole exercise ends, and then we will see how many cases we identify. At this point, we can see it's effective. We now have more than 2,000 RT positive cases picked up. 70% or close to 70% are asymptomatic carriers. Had these people not done the RT test, they wouldn't know they have been infected. And they would have been out and about and come into contact with other people, and the transmission would have gone on and on, leading to more cases in the community. We have picked up more than 2,000 cases now, so that means it's effective. Compare that with what we pick up through PCR tests. We're now picking up more cases. The ratio of PCR versus RT cases, the ratio was 1.1, but yes, as of yesterday, we now have the ratio at 1.8 to 1. There's also, but the problem is we don't have the denominator now because we don't know how many people are taking part in the RT exercise. So we hope more people can take part in this exercise so that we can cover more cases. The other question about compulsory universal testing. If we go ahead with this, we have to review the situation after the 3-day RT exercise wraps up. We also have to consider our capacity for PCR tests and the impact on people. Finally, class resumption. I believe the Education Bureau will announce the detailed plans about class resumption. The key thing is key risk management to minimize the risk of outbreaks at schools. Testing helps. This is an effective way to help prevent cases from finding their ways in the schools. If students test positive, they should stay home, and schools should also report the cases to us. And we will advise the schools on the measures they should take. We'll take the next question, English question.
From SCMP News. A few English questions. Yesterday it was mentioned that for the RAT testing scheme, there are issues of people reporting their negative tests on the RAT platform. I'm wondering if the situation for that has improved recently, or has the communication between the public to carry out the testing drive in general improved today, or can more be done to enhance the communication? And second question, just now earlier it was announced there was a 2-week ban for Turkish Airlines, but before that the airline had to make their own announcement that they received the CHP ban. So why was the Turkish Airlines ban not announced by CHP last night, and why is there some inconsistency in terms of announcing some of the flight bans? Is it fair for Hong Kong residents if you don't tell them in advance of a flight ban? Thank you.
Two questions. For the first question on reporting of RAT positive results to our platform, yesterday we noticed that some citizens they have performed the RAT test and was tested negative, but however they have misunderstanding that they need to report their negative results to the platform. So they have go to our platform and report the results to us. There are a few of these citizens, and they have uploaded their negative photos. So yesterday we have reminded people that they only need to report to the platform if they were tested positive, because after the reporting, we will they need to complete a questionnaire on the risk assessment. They need to submit their personal and also health information to us, and also the information on their home environment, so that we can make assessment on the suitable sites of isolation for these people, and also issue isolation order for them, and also quarantine order for their household contacts. So this platform is not for reporting of negative results. Yesterday we have made some enhancement in our website, and so starting from yesterday evening, people when they go up to our website, they need to there will be a pop-up box reminding them, and also they need to verify that they are tested positive with 2 lines on the RAT kits before they start to report. And also we also have another random survey or random sampling. We will select a certain number of RAT positive cases and arrange them to have RAT PCR test to verify their results. For the flight suspension for TK083, on arrival on the 8th of April, there are 3 cases on this flight. So yesterday evening, the Food and Health Bureau has suspended Turkish Airlines from Istanbul to Hong Kong for 7 days, starting from today, 10th of April, and we will announce it in our press release today. Yes, because it is decided in the evening, because we need to do some investigation on the cases to see whether they are recent cases or repositive cases, so this takes time.
下一題，呢邊呢位先。
Next, the gentleman over there, please. I'm from AM730. About the mass RAT testing exercise, you mentioned 2,202 cases. How many isolation and quarantine orders have you issued? And have these people been vaccinated? And do you have further breakdown about how many cases of the cases with symptoms? How many are silent carriers? And how many have reported positive cases wrongly? How did you find out about these? Now, close contacts are mainly household close contacts. Now, what about when schools resume? Would you track close contacts in school when there are cases? Or would you just follow up on household close contact cases? You've asked these questions. First question is about isolation order for positive results declared online, and if people have uploaded their photo and Hong Kong ID card, then there will be an automatic issuance of isolation order. The place of isolation will be based on our risk assessment, because when they declare the case, they have to fill in a questionnaire, and then we will look at the information provided, and we'll do triaging, which is in line with the current triaging management policy. So, for example, we see whether the cases have symptoms and whether these are high-risk cases. Are people able to take care of themselves? Are they able to monitor their own health condition? We also look at the household condition. And then when they declare the case, of course, they have to provide information about their family members, and then we'll issue SMS to family members. And when family members receive SMS, they have to input their ID card number and their phone number so they could get isolation, a quarantine order. As for some who mistakenly think that they need to declare negative cases, there are a handful of those cases. It's happened before on the platform, and we would do random checks, and so that is among the successfully declared cases, we will randomly pick some cases, and it was ask our contractor to go to their homes for nasopharyngeal swabs, so we could do PCR tests. And we have found that less than 5% of the cases are actually negative. And for these negative cases, we'll do investigation to see why the PCR test is negative. Is there fraud involved, or is it a case of a positive case or false positive case? So for these cases, of course, we will cancel the isolation orders, and we will also remove the case. As for tracking of close contacts after classes resume, now we focus on quarantine for household close contacts. For students, if they become close contacts, of course, they can't go to school. And if there are positive cases in school, we will conduct investigation, we will take public health measures. But then this time round, things are different than that for the fourth wave, because in the fifth wave, there's not available RAT. So students could take RAT before they go to school. Then the risk of cases going into a school would be minimized. Of course, we'll update our prevention and control guidelines for schools. For example, when students take meals, what sort of precautionary measures are necessary, and then so we could minimize the risk of infection among students. Sorry, the speaker's not using microphone. I don't have the actual figures at hand. I think we are talking about 2,000 or so cases. Mostly these are family members. Next question. I'm from Ming Pao. Good afternoon. I want to ask about the RAT. Now, there are 2,000 or so cases, asymptomatic cases. 2,000 plus cases over 2 days. And then you mentioned figures for asymptomatic and symptomatic cases. And then there are also cases that tested positive with RAT, but then they are reported via other channels. Why? Because they have done so after the 24-hour period or what? And then if you receive declaration of these cases, does it show that there are, say, elderly who've had difficulties declaring their cases or what? And my other question, you gave us the analysis of serious cases involving children. So what is the percentage of serious cases involving children? And you assess how serious the situation is? What sort of symptoms or problems there are with the serious cases, do you know? And then You say you're going to update the prevention and control guidelines for schools to minimize risk of infection. When would you update the guidelines, or have you already done so online? For the 62-year-old case mentioned, Dr. Lau, do you have the patient's vaccination record? And for this 62-year-old and the 31-year-old cases, did they die with or die of COVID?
或者我答咗。
Take the questions first, and I'll invite Dr. Lau to tell us more details about the cases. For the 2,202 cases, 68.7% are asymptomatic patients. This number is higher than the cases we found before April 8th. For those cases, asymptomatic cases made up roughly 35%. Over the past 2 days, there has been an increase in asymptomatic patients who did an RAT test and submitted their positive results. In terms of the absolute number, there has been a noticeable increase in RAT positive cases. As PCR cases drop, RAT positive cases have increased. For a small number of cases submitted by other channels, elderly care homes did RAT tests for their residents. We include these reported cases into our total tally, but these cases were not submitted on the online platform. Starting from yesterday, some people called the Home Affairs Department hotline as they may have struggled with our online platform. The HAD referred those cases to us. As these cases may have struggled with the internet, we provide assistance. There are also cases who used RAT at designated hotels. But the question about critical cases among children, we had this preliminary analysis. Among child COVID patients, some serious cases were admitted to HA hospitals. We looked at the information from the hospital authority. Some clinicians have determined that some of the cases were serious cases. Some even required treatment at the intensive care unit as they were in critical condition. For cases determined as serious or critical, we tallied the number of such cases. As of April 3rd, we have 48 such cases. We use the vaccination status as the denominator, vaccinated or the number of jabs. And then we'll look at the number of, for those unvaccinated, 8 out of 10,000 were in critical or serious condition. And as the more jabs they had, the fewer people or fewer children were in critical or serious condition. That means vaccination helps reduce the risk of serious infection. But this does not include details as to why they were admitted to the ICU, etc. As for the prevention guidelines for schools, guidelines regarding ventilation systems, etc. have been uploaded to our platform. As for the other guidelines, the CHP has issued the prevention and guidelines to schools. The guidelines will be updated again before class resumption, but some details are still being discussed with the Education Bureau. Later on, the EDB will announce the details about the class resumption. As for the 62-year-old patient, the resident at the elderly care home, in July last year, this person had the second dose of Comirnaty. On March 13th, the patient was hospitalized and then was transferred to the Buddhist hospital. We administered remdesivir and antivirals. The patient was recovering. The transfer to the Buddhist hospital was due to the malignant tumor, which spread to other parts of his body. At the Buddhist hospital, he received palliative care. He passed away yesterday. we don't know if the experts have determined whether he died of or with COVID. But the preliminary signs show that this patient recovered from COVID. But the death may have to do with his existing condition, the tumor. As for the other male in his 30s, he died rather rapidly. His heartbeat and breathing stopped at home. So he has been taken to a public mortuary. The cause of death will not be known until the coroner's court looks into the case. We don't know if his death has to do with COVID yet, but the RAT test at the A&E department came back negative. Next question. The lady over there. I'm from Hong Kong 01. There are now more cases of asymptomatic patients relaxing the social distancing restrictions now. Is that a sign? Is that a sign that we're living with the COVID now? Are we testing the waters now with class resumption? Does it mean that in the future people will all have to do RAT tests before going out? Not every family can afford buying RAT kits. Are the authorities discussing whether to hand out test kits to households? We just mentioned 5 cases picked up at designated hotels. Do we have cases picked up, that is, cases who returned to Hong Kong after April 1st and then tested positive after going into the community? Thank you for your questions. For those asymptomatic RAT positive cases, these are silent carriers. These people have no symptoms. They wouldn't have known they were infected were it not for the RAT test. They have been there with or without the RAT exercise. Before the 3-day RAT exercise, there were roughly 2,000 new infections reported every day. We have always had these silent carriers. But through the 3-day RAT testing exercise, we have uncovered carriers that would otherwise have remained silent. This exercise helps us identify such cases, because without identifying cases, these cases may have spread the virus to other people, as people would have get tested only after they have developed symptoms, or at some point the virus gets spread to seniors. And then upon hospital admission, we find out that the cases probably came from some silent carriers. It's a good sign that we are uncovering silent cases, and it's also a positive sign that we are picking up more cases. After the cases are identified, they're isolated so that they do not spread the virus further in the community. For the social distancing measures, as the Chief Executive mentioned, in the coming week, the government will announce more details as long as there is no rebounding cases and remain at a stable level, or there's a steady downward trend in infections. Some measures may be relaxed. For the RAT exercise, people are now more familiar with the RAT test. With such a kit, it takes just a few minutes to do the test, and then the result comes out in less than half an hour, and people can do the test at home. This is both an effective and convenient way for people to know if they have been infected. And previously, they would have to go to a testing center and had to wait before they can know the result. We encourage people to do regular tests with RAT kits to find out whether they have been infected, so that if they are infected, we can identify them quickly. For RAT arrangements after class resumption, I believe the Education Bureau will announce the details later on. The government has enough RAT kits. When necessary, the RAT kits can be provided to those who need them. For those who have completed their quarantine at designated hotels, now we haven't found any cases where people test positive after finishing the quarantine. Now, after the place-specific flight suspension mechanism is relaxed, we also have a new arrangement for the quarantine period being shortened to for people who have completed the 7-day isolation in the hotel, quarantine in the hotel. On day 12, they have to do a PCR test at the community testing center. The first batch of arrivals may be doing the PCR test in these 2 days, but I haven't heard about any infections so far.
I'm from Hong Kong Economic Times. For RAT, there are 2,200 plus cases. And then from the mass voluntary RAT testing cases, there are 2,202 cases. So how did you arrive at this figure after discounting cases from quarantine hotels and so on? So without the mass RAT, so you're saying then you won't be able to come up with this number of 2,200, is that right? For the 31-year-old deceased male, now he had mild pericarditis. Has he recovered from that? So has it to do with that case? Because it seems that he had the disease quite some time ago, and then you don't know he's been infected. So are there any close contacts, say, among nurses or other patients? And for the death case, there's one death case who the person's received 3 jabs. So do you have more details? And then for the 48 child cases, do they have any problems? There's 38 serious cases. So are there any cases of children who've had 2 jabs and who were critical or serious after being infected? I'll take the first 2 questions, and perhaps Dr. Lau could answer the third one. The 2,202 cases. These are all successfully declared cases, meaning the patients concerned have all received the isolation order. And yesterday, there's just a handful of cases that did not come through the declaration platform. I mentioned 1,033 RAT positive cases for yesterday. Of that, 969 cases were declared by the platform. For the remaining 66 cases, they were declared through other channels, for example, from residential care homes. Now, we wouldn't say that if we didn't have the mass voluntary RAT testing, then we wouldn't find these 2,000 plus cases, because some of these cases are, say, symptomatic. So without the mass testing exercise, people may still do the RAT when they have symptoms, and then we will record cases. But then for what we see is that there is a high percentage of asymptomatic cases, so that's reversed the ratio. If we look at the PCR, and then if you do use PCR tests, positive cases to do projection, then for yesterday, there should be just about 800 or so RAT positive cases based on the PCR positive cases. But then yesterday there were some 1,600 RAT positive cases. That shows that there are more people doing RAT, and so more cases are found, especially among those with no symptoms. As for serious cases, well, as I said, it's just an initial analysis. We have not looked at the actual clinical assessment of each of these cases. We will get more information from the hospital authority so we could do a more detailed analysis. But then the figures themselves are self-explanatory. Among those not vaccinated, there will be 8 serious cases out of 10 per 10,000. For those who have had 1 jab, is 2 cases per 10,000. And then for those who've had 2 jabs or more, then it's just 1 case per 10,000. That shows, therefore, among children, vaccination is also very effective to prevent serious cases. For the 31-year-old deceased patient, between the 17th and the 20th, he stayed in a public hospital. As I said, when he was admitted, there were irregularities in his ECT. We also did ultrasound on his heart, so that's why we suspected he had myopericarditis. We gave him medication, and then there was good progress. His symptoms improved while he was in hospital. And then when he was discharged, he was referred to do an examination, and he was asked to come back for follow-up consultation. But from our record, we don't see any follow-up consultation for him. Now, what happened was he fainted at home, and then by the time he arrived at hospital, he had no heartbeat and no breathing. As for the actual cause of death, I think we have to wait till the coroner has done the autopsy and investigation before we can be sure about the cause of death. For the patient who's had 3 doses of vaccine, so he had 2 doses of CoronaVac and 1 dose of the BioNTech vaccine. Now that patient had some underlying condition, hypertension, and B, lymphatic disease. And that disease would lead to a low red blood count, white blood count. And you know, of course, white blood count is important for preventing infection. So because of disease, he had low blood count, and maybe for that reason, even if he had 3 doses of vaccine, he could be prone to complications. Now, we have administered different antiviral drugs to him, including remdesivir, but unfortunately, the patient passed away yesterday. Thank you. That's the end of the press briefing. Thank you.